Health is the ability to realize aspirations, satisfy needs, and cope with a changing environment. Never was that more true than in the pandemic. When I was thinking about this, I thought about my daughter who has an intellectual and a physical disability. And she lives very well because of all the support she has around her and everything that the community does with her. All the things that you have to have. The pandemic laid out really in an open way that some people didn't have those things. And then collectively, our responsibility is to try to meet them. Lanark County had a great job. They had a whole table of community people who were looking at what, including the United Way, to see what are the resources. We live in a rural area. Transportation is a big issue. And Lanark worked with others and have had a transportation program. So I think it's a continuous thing of thinking out, what do we need to do so people don't get left behind?
The history of our public health field is one of social justice, and it's recognizing that your health status being different based on who you are, it's not fair. And so we want to work on the societal policies that will enable us to have fair chances for everyone. For example, our Board of Health advocated for sick leave benefits so people could stay home when they're sick and not have to choose between having enough food on the table or possibly exposing others in the workplace. We're going to need to continue policy work to inform what happens with housing and social services and early childhood. You know, these are foundational. Ottawa Public Health has really made an effort to understand where are the needs greatest. And that has involved working with communities and community leaders and partners to better inform our work.
I mean, this is, let's face it, it was a crisis, and we were going week by week, day by day, even sometimes hour by hour. So what that did was it fostered collaboration. We tried to make sure that we were learning quickly from other people's experiences, and also that we had some uniformity, because when you have asymmetry, when Ottawa's doing one thing and Renfrew's doing another thing, people pick up on that very quickly and they'll call you out on it. So that was very important. We were able to mobilize the family physicians quickly with the VTAC, that's the Virtual Triage Assessment Center. And with that, we were able to arrange for the paramedics to do the testing. Getting back to that near normal, it's the biggest challenge is going to be for folks who have these social inequalities. So getting the kids back to school, increasing the employment level, providing the safety net, catching up on immunizations. There's all kinds of work that needs to be done.
I think that one of the most important things that we need to realize is the effects, the mental health effects on all our population, particularly among our most vulnerable and particularly among the children of those most vulnerable. And as a pediatrician, this has been my goal in order to address those issues that occur in the first couple of years of life. Early child development really determines your whole life spectrum. The best way to move forward at this stage of the pandemic is to do what we've always been doing, is get together with the community partners, understand the community needs, identify the issues among the vulnerable populations, and coalesce together to be able to address them. One of the things that I'm heartened about and very pleased to see is the resiliency and the commitment to the community of all of our staff. This has brought out what I always thought. I knew that our staff at the Eastern Ontario Health Unit were committed, professional, dedicated to the community, but this has really put a spotlight on that.
I think we can continue to be inspired by that care that people have for each other and, you know, continue to move forward and think about the other things we can do.
Some great people have shown themselves, and this comes out with the collaboration we've seen. It comes out with the acts of courage.
We talk about the virus all the time, but the pandemic is about people. And I think that's what keeps me going, is the people.